as Percocet, is disguised as Xanax, and these days with people suffering, as we know from our Surgeon General, of more mental health issues, we know of so many kids that are ordering this on Snapchat, thinking that they're getting Xanax, they're getting Oxycontin, they're getting Percocet, but instead, their parents are finding them dead in their room. This is not a problem somewhere else. 12 children between the ages of 13 and 17 died in 2021 from fentanyl overdoses. This is part of that 817 figure of overdose deaths, with all of the young lives that were lost in San Diego County. Almost half of the overdoses happen in the city of San Diego because it is the largest. The efforts that we are undertaking in law enforcement, you're going to hear more about, but it is working collaboratively in task forces, in FAST, in the Fentanyl Abatement and Suppression Team that is led by the U.S. Attorney. It's working with Team 10, the overdose opioid response, with DEA SAC Shelley Howe and her team. It is fighting this as a homicide often because this is what it is. Everybody knows fentanyl kills, that one pill can kill. But yet, these dealers continue to sell it for profit. We've even had cases where the dealer knew that that very batch that they sold killed someone, and they were ready to sell it to the next undercover agent. So we knew for a fact that these people are operating with complete heartlessness. This is not just a legal issue. The devastation on families that I meet with on a regular basis, seeing that look that will never, never leave me, this look of a mother finding her 14-year-old in their room dead, from life to death instantly because of fentanyl. Our laws are completely inadequate. It is music to my ears that we will have the support of Mayor Gloria, the support of Mayor Gloria in changing the laws. Can you imagine that if somebody sold fentanyl, their maximum sentence is 3 years under state law? And even if they killed someone, their maximum sentence is 3 years. We do not have enhancements in the state of California for the resulting damage. Last year, we tried to pass legislation that coordinated and had punishment fit the crime, but that failed. But I am hopeful that this year, with the help of Mayor Gloria and the help of the community and the partners here, that we will have fair justice for these deaths by having the injury be accounted for. Great bodily injury that results, that sends somebody to a hospital, injury that ends them in a wheelchair like a young man I know, injury that ends them at the morgue, that needs to be accounted for. In San Diego County, the way we deal with this is through working to make a homicide case. That takes a lot of elements of crime to be proven beyond that the injury resulted. We have to show and prove in a state of mind that shows a conscious disregard for life. We've been successful in 7 cases in bringing homicide cases and getting convictions in all 7. But that's 7 out of the 506 defendants we prosecuted just last year for dealing fentanyl through our major narcotics division. So a change, and we're a country of laws, a change in the laws to meet the moment is going to be critical. Change in the laws in order for the advisal that we use in San Diego for drug dealers to advise them that the next time they deal and hurt somebody, they could be charged with murder, just like the Watson advisal we use with drunk driving cases. That is not law. It's something that we're doing in San Diego that is being copied across the state, but we want that to be law. But we also know that prosecution alone is not going to solve the issue, that we need prevention. We need education in our schools. Do you know that in 2009, the education about drug prevention in our schools went away? And we didn't bring it back. We need to bring it back in order to save lives. I am very encouraged today and thankful for this attention that's being brought to this issue. We'll continue to fight to save lives. Thank you. And next, it's my honor to call Sheriff-elect Kelly Martinez to say a few words.
Thank you, Summer. Kelly Martinez, and I'm really grateful that Mayor Gloria is jumping in on this fight and committing his resources to combat this crisis. You've been hearing about the regional impact of fentanyl, and this is a crisis that continues to grow. Speaking from the sheriff's perspective, we've seen an enormous increase in our communities. So far in 2022, patrol deputies have responded to 181 overdose calls across San Diego County. From those calls, 124 individuals survived and 54 died. That's an enormous impact not only on our staff and our communities and the families and individuals that are affected by these overdoses. Our federal partners are calling San Diego County the epicenter or ground zero of fentanyl smuggling in the country due to our proximity to the border. The Sheriff's Department is committed to fighting fentanyl that's coming across the border. We have committed teams that work not only with state, local, and federal partners, but also on our own. We've committed ourselves to combating this and bring in thousands of pounds of fentanyl every year. From October 2021 through June 2022, the U.S. Customs and Border Protection seized more than 5,000 pounds of fentanyl at the ports of entry, checkpoints, and other law enforcement operations in San Diego and Imperial counties. This amounts to 60% of all the fentanyl seizures across the nation during the same time span. In 2014, the Sheriff's Department, San Diego County, worked on legislation to allow deputies and law enforcement officers to carry life-saving naloxone in the field. Since that time, we've been carrying naloxone and using it almost daily. In just the last 3 years, deputies and professional staff have used naloxone 734 times while on patrol, in our courthouses, and in the jails for suspected overdose cases. This year, we started making naloxone available to the people who are in our custody because the problem is so severe. While the number of incidents is 734, the total doses administered is 1,810, with many incidents requiring 2 or more doses to bring people back. In 2017, we started an overdose protocol in the Sheriff's Department. When deputies encounter an overdose death, we respond to the scene and follow all available leads to trace the drug from the overdose victim to the supplier. We treat each of these cases as a potential homicide. In 2018, the sheriff's investigators submitted the first case that was successfully prosecuted by our district attorney as a manslaughter case when an individual knowingly supplied deadly fentanyl to someone who died from ingesting that drug. Our standard on the Sheriff's Department is to investigate each of these overdose deaths as a possible homicide, as I said. We continue to work with the DA's office, the U.S. Attorney's Office for the Southern District of California, in holding those accountable for supplying fentanyl that results in someone's death. We must focus, as the DA said, on education and information. We need to eliminate the supply of fentanyl in our communities, and we need to reduce the demand, and the good work of Mayor Gloria and the county in developing programs that focus on substance use disorder and harm reduction is really key. And we must also have the system in place where we save lives when people do overdose. And we do that with a wider availability of naloxone. Now I'd like to introduce the U.S. Attorney, Randy Grossman. Thank you.
Thank you. Good morning. Mr. Mayor, thank you for inviting me to attend this important conversation and participate. Unfortunately, San Diego has become the epicenter for fentanyl trafficking in the United States. The amount of fentanyl that we are seizing at the border is staggering, and the number of deaths that we are seeing in San Diego is unprecedented. Border officials are seizing more fentanyl in our district, San Diego County and Imperial County, than anywhere else in the nation. 54% of all fentanyl seized by Customs and Border Protection was in San Diego and Imperial Counties last fiscal year. 4 tons of fentanyl was seized. That's up 20% from last fiscal year. This is a top priority for the United States Attorney's Office and the Department of Justice and our law enforcement partners. And our strategies are focused both on aggressive prosecution and prevention. Our prosecutions attack all levels of fentanyl distribution, from international drug traffickers to drug trafficking organizations and street-level dealers here in San Diego County. Overall, our office's fentanyl-related prosecutions are up 1,600% in the last 5 years. And if you are dealing fentanyl in San Diego County or Imperial County, you do not want to be on the other side of a federal indictment from our office. Selling fentanyl or distributing fentanyl that results in death carries a mandatory minimum sentence of 20 years in a federal prison. We've prosecuted and sentenced 10 defendants under this law within the last 12 months. Our office and our law enforcement partners have also created a multi-agency fentanyl abatement and suppression team that's designed to specifically target fentanyl distribution networks that are responsible for the deaths in our communities. All of this work is part of a combined law enforcement response that includes tremendous cooperation from our federal, state, and local partners. We are working as a team together to disrupt the supply of fentanyl and hold traffickers accountable. And we are highly motivated, because lives are at stake. And that's why prevention must also be part of our strategy. Through multiple outreach programs from our office and with our local, state, and federal partners and our community partners, we will continue to educate everyone from middle school age children to those who have been using this substance for a long time and are in the depths of their addiction. We encourage the public to do the same. Have conversations early and have them often. And the message is simple. Fentanyl kills, and it is everywhere. You don't know what you're getting, and what you hope may be an experiment just may cost you your life. Mr. Mayor and our law enforcement colleagues, I want to thank you again for the opportunity to be here and our partnership to take back our communities and our nation from the clutch of fentanyl. On behalf of the U.S. Attorney's Office, we are all in on this fight. On behalf of the overdose victims and their loved ones who have been devastated by this scourge, I assure you that we will relentlessly pursue justice for those victims. We will relentlessly pursue justice against the traffickers, and we will do everything that we can to prevent further harm to our communities. Thank you. I'd like to now introduce the Special Agent in Charge for San Diego for the DEA, Shelley Howe.
Thank you, Randy. Good morning, and thank you for having me today, Mr. Mayor. In 2021, the Drug Enforcement Administration nationwide has seized enough fentanyl for every American to have a lethal dose. In the last 3 years, here in San Diego County, we are seizing fentanyl in record amounts. What are we doing about this problem? Well, we are attacking it at every level. We formed an overdose response team comprised of 7 different law enforcement agencies, local, state, and federal, where we are targeting the drug dealers that are providing that lethal dose of fentanyl that is poisoning our loved ones. We are targeting violent criminal organizations and violent gangs that are distributing fentanyl in our county. We are going after the cartels that are manufacturing and importing this deadly drug across our borders that is driving addiction. I assure you this, the Drug Enforcement Administration is dedicated and committed to combating this deadly epidemic that we are seeing at a national and local level. In San Diego, we will continue to work closely with our partners to keep our community safe. Thank you. And I would like to introduce San Diego Police Chief Dave Neslite.
Thank you, Shelley. Good morning to all of you. First and foremost, I want to thank the mayor for making this a priority, not just for law enforcement, for all my great partners that are standing behind me, but also making it a priority for the city. I want to say for the San Diego Police Department, we receive calls every day related to drug use, sales, and in some unfortunate cases, overdose and death. And I will close by giving a recent example from this morning. I'm here to reassure our communities that San Diego police officers are out there every day doing what they can to address this crisis. They are proactively investigating known areas for drug use and sales. They are following up on reports from concerned residents, and they are citing and arresting those in possession of illegal substances. As you've heard, we know that the deaths related to drug use are skyrocketing. Homeless encampments become targets for drug activity, assault, and trafficking. As you've heard, also, our officers are equipped with Narcan to assist individuals when overdose happens, but we need to stop it at the source. Therefore, and in continuation of what we are currently doing, we will be working with our partners at the local, state, and federal levels to apprehend the criminals putting these drugs on the street, to address the illicit use of drugs in the public, which will ultimately save lives. Now, I want to just close with a recent example from this morning. And this is an example of calls that we respond to every single day, along with our firefighter partners and medics. So we were able to save two, but 2 young people lost their lives. Now, I can't say with certainty right now because the investigation is so new that is fentanyl related, but we know they're overdose deaths. And as we've spoken about all day or all morning, currently on the scene is Narcotic Team 10, which is a task force from the DEA with members from state, local, including San Diego police officers, and our homicide team is also on that scene. And we will work this case as a homicide. And if we can prove who is responsible for providing those lethal doses, we will then send it over to either the district attorney or the U.S. attorney for prosecution. I want to thank everybody for being here. Thank you for making this such a priority as this is a crisis. And now I will turn it back over to Mayor Gloria.
Thank you, Chief. And thank you to all of the law enforcement partners who are here this morning. We're happy to take questions. I want to point out we also have our city's chief medical officer here, as well as representatives from our fire rescue department. You might imagine these individuals are the ones who on a daily basis interact and respond to a lot of those 911 calls for service and can tell you firsthand what our personnel are seeing out on the streets here in San Diego. But I appreciate you all being here this morning to help us get this word out. This is a relatively new phenomenon in terms of this particular substance, but is having an outsized impact in our community. And it is one of the biggest differences I see in the world of homelessness when we see some of the erratic behavior, some of the hoarding and other sorts of behaviors that are so alarming to San Diegans. I'm not sure they always understand that we can draw it back to this particular issue and understand why we have to tackle it aggressively. And then as the chief mentioned and as the DA mentioned, often this is happening in homes, in hotel rooms, in places across this community. And so this is happening all around us, but I don't think we talk about it enough. And a part of what we have to do is elevate this issue, both locally, statewide, and nationally to get change that we're looking for. Ultimately, this is a major issue. We have to treat it as such, and today's announcement is indicative of the fact that we are working in collaboration and coordination, as we often do here in San Diego law enforcement, but we're elevating this particular effort because the demand is out there, because the need is evident, and because lives are at stake. And I appreciate the media being here to help us transmit that message to the public. This is serious. You need to take it that seriously and know that your public safety professionals are taking this extremely seriously. With that, all of us are available for any questions. Who would like to hop in? Kelly, and we'll go to Audrey.
Several questions, actually.
Please.
I'll just go with a couple first. So according to the Medical Examiner, at least 42 homeless people have died from complications of fentanyl use. And I know you already touched on this a little bit, talking about the executive order that you're issuing, but in addition to that, also 311 homeless people have died in San Diego in general, whether or not it was fentanyl related. What is your office going to do specifically to address these deaths that are fentanyl related and also just the deaths of homeless people?
Well, obviously, today's announcement is laser focused on the question of fentanyl and opioid abuse. But what you look at what my administration's done over the last 2 years in growing the offerings that we have for our homeless population, whether that's coordinated street outreach in every city council district in the city, growing our shelter capacity by 40% and diversifying those offerings. And we think we've been together at some of these shelter openings. It's not just a tent and welcoming people in the door. Increasingly, we're partnering with the County of San Diego to make sure that it's the shelter that we provide, along with the behavioral health and substance abuse services that they provide. Working together, we can have a greater impact on those individuals who are at least willing to come out and get shelter, get food, get some safety, but provide the counseling and the treatment that hopefully will end their addiction. And then we continue to expand the amount of permanent supportive housing in our community, recognizing that addiction for those who are in recovery is a daily battle, and making sure that those who are able to be stably housed have the wraparound services to continue to keep them housed for the long haul. That's what the city can do. What we're saying today is that, of course, that we have to lean on our partners who have more direct interactions with behavioral health and substance abuse disorder. The city doesn't have a mental health or substance abuse or health and human services agency. That is our county partner, so that's why that partnership is really important. The state is a prime mover in this, and our governor has called for cities and counties to do more. I'm game to do more. We need more resources, and we can work together to do that. But ultimately, what you're asking about is part of why we're here. You know, Mass, why are these numbers of fatalities increasing? Well, there's a multitude of reasons, but the number one reason is opioid abuse and fentanyl. And so we want to bring this to the public's attention and hope that that awareness starts to, some of what my friends here say, it helps with prevention, but hopefully helps also animate why we're putting more dollars towards these shelters with services to outreach workers with Narcan, with the kinds of stuff where we're directly being helpful, recognizing the city in many cases is at the front lines, but we're not the prime jurisdiction for this. Often we have to work with other agencies, and that's precisely what we're doing. And it's also what the executive order is about, right? Asking our government affairs department to partner with the state and the federal government to make sure that those cooperations are yielding the results that we need to see, results that have to be scaled up because of the size of this problem. Audra?
So next steps.
Mm-hmm.
You've issued this executive order. You're
We will be.
directing them to do these things. So what's your timeline look like to get some of this going and in place?
Well, the executive order will be signed this month, so that will be forthcoming. As you already hear, what we want to do is support the efforts that are here through our county partners, our federal partners. Have had the opportunity to do everything from tour our medical examiner to see firsthand what the coroner's office is having to deal with regard to the number of bodies that are literally coming in the door every day because of this, or going down to the San Ysidro Port of Entry and walking with our Customs and Border Protection officers who are on the front lines. And as you've heard from Randy and from the sheriff, that we are interdicting a ton of stuff, but obviously it's not enough to prevent this flow. So we've done a lot of work. We're going to continue to do more work. I think what the most tangible things that you may see visibly in the near term will be the reintroduction of some of the legislation that the DA has mentioned with the support of the city of San Diego, and then utilizing the platforms that San Diegans have given me to try and make sure that these bills are successful in the legislative process, helping to educate some of my former colleagues in the state legislature. I was privileged and honored to serve in the state assembly for 4 years, to use those relationships that I built up over those years to say this is a major issue. Part of my concern is, again, this is relatively new. I want to make sure everyone understands how severe this is. We gave you a lot of numbers about San Diego, but those numbers are equally bad in jurisdictions up and down the state across this country. I think when people are made aware of just how dire this is, some new approaches will be hopefully accepted, implemented, and then allow these folks to have more tools to actually get this stuff off the street and save lives. Yeah, Elizabeth.
I have a question about kids getting opioids from TikTok.
Mm.
What jurisdiction, who has jurisdiction over that? And what does that look like when that is investigated?
I'll ask any of our partners here. I'm not sure who that is.
Yeah, and I'll let
And all of you.
Shelley or anybody. So, it's always going to be a collaborative effort. So if we get information, whether it comes from a social media source, comes from a community member, it's going to be fully investigated, and it could be investigated by any one of us or all of us combined working together. So that's the beautiful thing about San Diego County is we do have great collaboration in this county. There is really no egos when it talks to what we look for is what can be best served to the community and who has the best resources to do that investigation. And sometimes it's combining the efforts to make certain that we address those, because we know kids are getting narcotics, fentanyl, everything from social media, from Craigslist ads, from you name it, they're finding it, right? So we have to attack it at all levels, and then we also have to look at the education and the prevention methods to make certain that we kind of prevent it from happening. But if it does happen, then going after those folks that are putting it on social media and getting it out onto the streets.
So just to picture it, are kids getting it mailed to them, like snail mail? Is it coming through the mail? Are they going somewhere and meeting someone to pick up the drug? What is that? Parents want to know, what does it look like?
It's yes to all that. It's yes. They can get it through the U.S. mail. They can get it by meeting somebody in a parking lot, at school, you name it, however they can arrange it is how they're doing it. And so that's why it takes that collaborative effort to really look at the source, but also, as a parent, it really takes parents being what I say, you have to be a very nosy parent. You have to know what your kids are doing, and you have to understand the dangers that lurk on these smart devices, whether it be a phone or a tablet, and social media, and the ability to get on the web and order up narcotics. So it really takes parents to understand what is going on, and really paying attention to what's going on in their kids' lives and noticing those demeanor changes, if you will, because that's a red flag that something is going on, and the parents need to pay attention and help us help other kids before it spreads like we're talking about this crisis now.
And lastly, on that same note, is this something that eventually gets prosecuted on a local, state, and federal level? I mean, are these different crimes?
I'll let either Summer or Randy handle that question.
Sure. So just to pick up on what the chief has said, the wonderful thing about our community is how collaborative we are. So you've heard about the different task forces and the different groups that we have. So we're all around the table. And there's a process in place where we triage a case. So if a case comes in from the police department or the sheriff's department or from the DEA, we have the right people around the table to say what is the right path for this case, based on the facts, based on the defendant. As you heard from us, we can get 20 years, a mandatory minimum of 20 years if someone is selling fentanyl and it kills somebody. But that requires certain elements of proof and certain legal issues. We just have a conversation with Summer and with the sheriff and with the police to make sure that that case gets on the right path. Depending on those circumstances, it will go either federal or state.
That was like something I was wondering then. It's like, well, what makes it a federal case versus a state? You're talking about 20 years. She's talking about 3.
Right.
You're talking about street-level dealers. What's the difference then, or how?
The statute, the language of the statute. So Congress has decided that if you sell fentanyl, if you distribute fentanyl and it results in death or great bodily injury, that there is a sufficient basis under federal law that will implicate our jurisdiction, the power of the federal court, the power of the federal prosecutors, and we use it. We bring it. And folks should know, if you're selling fentanyl on the street and you kill someone, like I said, you can be on the other side of an indictment from our office.
How is it an indictment sometimes versus what she's talking about the street level? Like, can you give us a scenario where it's like, obviously this doesn't go federal and in that case we go state?
We like to take as many of those cases as we can. I mean, sometimes it comes down to resources, in terms of the number of resources and the availability of resources that we have in our office versus Summers, but also it comes down to the individual circumstances involving the defendant, their criminal history, the kind of nature and circumstances of the crime. But again, that decision is made very thoughtfully and carefully about where we can make the greatest impact on the community, on the defendant, and achieve best justice for the victims of the crime.
One last question. Summer, if you could talk a little bit more about, you mentioned the 14-year-old girl who passed away. I believe she was a high school student up in North County. Can you tell us a little bit more about that situation, or some of these younger people that are dying from it, specific sort of cases?
In most of the younger people dying, there's a connection with the school, with a friend, with something that seems safe to the kids. Like, this person wouldn't hurt me. They wouldn't give me a pill that's going to hurt me. Also, the internet is involved with kids. I mean, Snapchat is a popular one, all of the others. And on that point, I think what is important is kids need clear information. And the reality is today, anything that doesn't come from a doctor or pharmacy is very likely to contain fentanyl. The percentages are very high. When the DEA tested some of this, it was much of the supply had some fentanyl. And so the message has to be clear. Whatever you're getting, not from a doctor, not from a pharmacy, is going to be fake. It's going to have fentanyl in it, and it's likely going to kill you. The other issue, as you know, some of you know, is near and dear to my heart, is the complete irresponsibility by these social media networks. It took so much work to bring down Backpage. They have algorithms by which they send people information to radicalize them one way or another, but they're not using those to protect our kids. You know, law enforcement, when we look at this communication, we know, even though they're not saying send me, you know, drugs, we know that that's what the conversation refers to. They're experts. To be responsible, their experts should be doing the same and should be blocking those messages, should be doing something to also help us, and they're not doing it.
If I can just piggyback on everything that we just talked about, we have initiated Operation Overdrive in conjunction with all of our partners here. And you bring up parents. What can we tell the parents? Parents, have the hard conversations with your children. Every platform is available for your children to order these pills or fentanyl. They are going to be sitting on the couch right in front of you, ordering fentanyl with emojis, and you will not know it. If you do not have these hard conversations with your children and discuss the importance of one pill can kill, it may be the last conversation you never were able to have with your child. It is that important. I just sat down with a mother yesterday for 2 hours that lost her son from taking half of a pill. She's beating herself up, right? There's nothing else she could have done. There was no prior drug use. It was half of a pill to help her son with anxiety. She had appointments scheduled to get it from a psychiatrist. But he wanted to self-medicate. Half of a pill, and he is gone. We have to have these conversations. Thank you.
Audra, please.
I have a question for the chief. I know the investigation is still underway, but are you able to give us any more details about this morning?
Yeah, just the call came in, I believe it was like 5:41 for both fire rescue and ourselves. I know ourselves got there, medics got there, found 4 people down. Administered Narcan, revived 2, but unfortunately, very tragically, 2 people, I believe in their 30s, lost their life. And, you know, again, I cannot say with certainty that it's fentanyl. We know our narcotics are in the house. You can see them. And so Team 10, which we've talked about, is a team that responds out to overdose deaths and overdoses, comprised of DEA, Sheriff, San Diego PD is there along with my homicide team to start this investigation. And hopefully maybe later today or tomorrow we can probably give you an update of what we found. But just really wanted to talk about this case because it shows the crisis that is currently in front of us.
Do you know men, women?
I know the decedent, 1 man, 1 woman.
And any relation between
That's everything that we're trying to determine in this investigation. Again, this call came in at, I believe, 5:40 this morning.
And when you get a call like that, especially on a day like this where you're coming here to talk about this, what goes through your mind?
It's occurring again. I mean, this is a daily call for ourselves and for fire rescue. This is not a unique case, unfortunately, and that's why we're talking about it. This is a daily case. Our officers, and I know our fire rescue and our medics, are administering Narcan, it seems like, on the daily. And although I don't have the numbers, the sheriff, it's probably close to 1,000, if not more. We are administering Narcan on the daily. We've had very good luck with saving a lot of lives, but unfortunately, we've not been able to save a lot of lives. And that's why you see all these folks here today talking about this crisis, because it is. We are losing young people. We are losing people from all walks of life. And we all need to make this a priority because we can save lives.
And Merit asked the same question of you hearing about this. This was people on the street. This is people that were inside a home.
Right. Well, it speaks to what I want to draw attention to. I absolutely understand the attractiveness of social media, and that is a part of this. There's no question, but it's also fairly mundane, right? It is an apartment building in North Park. probably behind the neighbors next door may have had no understanding what was going on there. It's a very different world than the one that I came up in, that maybe you came up in. It's not just social media, but it's the fact that this stuff can be mailed to you. It's the fact that it's very discreet, that you may not always know what's going on, and it makes their jobs a lot more difficult. So I'm deeply grateful for the amount of resources, time, and attention, priority that they provide. We're asking them and pushing them for more because we need to rise up to this occasion. But to your question, I guess what I'm here saying to you, saying in 2 years of being mayor, this happens a lot. It happens way too much, and we can't stand for it. And so while this drug is relatively new, the way it's conveyed and given to people is relatively new or different, the fact of the matter is our resolve to tackle this is not new. We will enforce laws, we will change laws if necessary, and we'll use the kinds of collaboration and relationships that we have here and elsewhere to get this under control. But ultimately, whether it's a apartment building in North Park, an encampment in East Village, a school site somewhere else in the community, this is happening way too often, and it has to stop. Anyone else?
Numbers on the Narcan administration. Do you have those with you?
Well, we'll get it to folks, and if there are no additional questions, we'll try and wrap up. I'm sure all these folks are busy, but if you want to grab any of them for individual questions. But I want to, again, express my appreciation to the media for being here. I know you all have done a lot of stories on it, but I think we can't talk about this enough given what's going on, and you all dedicating your valuable time to help us explain what's going on, what we're trying to do about it, the work that's existing and the new work that's happening. I hope what you leave is a real sense that we have some professionals that are working hard on this issue, and as difficult as this epidemic is, I think that's a cause for some comfort in the fact that we have this level of professionalism, competency, and experience to help get this under control. I thank every one of these public servants for what they're doing and ask you to take it back to your teams who are doing this work daily. We can't thank these folks enough, but as you heard from our DEA special agent, this also requires your active participation in this matter. You can't leave it up to our law enforcement professionals. It's probably too late at that point. Have those difficult conversations. Educate yourself and your loved ones, both seniors and young people. This doesn't really discriminate, am I right? We all have to be involved in this, and you all are part of that, and so I'm deeply grateful you take the time to be here this morning. Talk to our fire rescue folks. They see it every single day. I think we believe about 400 service hours every day of our service personnel is dedicated to responding to people in mental health crisis, substance abuse crisis. This is taking a considerable amount of our time and our resources that can't go to other things that we need them to go to, right? So if we can get this under control, we can improve service levels elsewhere in the community to prevent and proactively address other quality of life concerns. So it's a big problem, but what you got a sense of is there's a big response and there's more coming. And I like what our U.S. attorney had to say. We want to be clear. If you're trying to do this in our community, we're going to come find you and we're going to hold you accountable. There will be consequences for killing San Diegans. Be very point blank clear to everybody in this situation. And you got a team of really tough people who are going to get that job done. Thank you all for being here. And again, grab any of us if you like one-on-ones. Thank you. Thank you for being here. Thank you. Appreciate you. Absolutely.